So make of this what you will. I maybe see 3 to 5 classic first MTP gouty attacks in a year,
Yeah.
but I see loads of patients who's had a history of having a gout attack, 1 or 2 attacks, and then never having an attack again. My takeaway from you is that these people are in danger.
Yes and no, Brian. So the ACR guidelines are if a person has 2 attacks within the year, then you initiate therapy. If you have a one and done kind of attack, it could have been dehydration. That's usually, the biggest culprit. When you go back and you think about if you had to answer a question real quick, what are the seasons of gout? What would you pick? Hippocrates actually got it right. It's spring and summer, and it's because of dehydration. So chances are, with those kind of patients, I'll look at kidney function. I always look at the kidney function to try to figure out, and you try to find out, do they exercise? Do they do any of that stuff? If not, a lot of people are walking around dehydrated and they don't know it.
Well, right. So but I also took away, maybe incorrectly, that if their urate is in the normal range, it's still ravaging their body.
Correct. If it once, and Mark will tell you the same thing. Listen, we have, Ben asked me not to do any kind of Krystexxa talk, but when I look at gout patients, I look at them like this. I do it a 1, 2, 3 approach. We look at the flare, we handle the flare. The next thing I talk about is how long have you had this disease state? Oh, I've had it, for 30 years. That tells me they have a tremendous urate burden. That urate is sitting in the body, wreaking all this metabolic dysfunction. And to me, it's almost criminal if you don't address it and help these people. So
And
what?
they may not have attacks.
But they don't. Correct. But you have
So this
all
is
these.
this is a patient profile that I'm not familiar with, honestly.
So Brian, think about this for a second. Patient comes in with a uric acid level of 10, all right? And we're going to say they're asymptomatic. They have no problem. Right. But what does the literature tell us? The literature tells us if it's 9 or higher, they're going to cut 10 years off their life. They're going to have a higher incidence of mortality. And